A very, very important day as we are celebrating the World Mental Health Day. And this year's theme is
Mental Health in an Unequal World.
Mental Health in an Unequal World. Mental health has become very, very rampant in our country. Mental health is a problem that is not affecting just our country, but it has become a global problem. We are here today not only just as student leaders, but also as ambassadors and champions for mental health. My name is Makula Boso. I'm the Daystar University Students Association President, and I also double up as the Kenya Private University Students Association President. We have a joint statement here that I'm going to read. So the statement is by the Joint University Students Presidents of Kenya, and I'll start. Comrades power!
Power!
Comrades viva!
Viva!
Comrades amandla!
Amandla!
We would like to address a serious issue that has continued to plague students at institutions of higher learning. That is the issue of mental health awareness. Today being World Mental Health Day, we would like to state as student leaders that there is no shame in speaking up or in seeking help. As student leaders, we are determined to increase awareness and, importantly, reduce the stigma. According to the World Health Organization, depression is one of the leading causes of disability, and suicide is the second leading cause of death among young people aged 15 to 29 years old. Depression, and we all know that this word is almost a taboo. It's a common illness worldwide. It affects 5% of all adults globally. We also know that depression can lead to suicide. According to the World Health Organization, people with severe mental health conditions die prematurely, as much as 2 decades early due to preventable physical conditions. WHO further reports that suicides in Kenya rose by 58% between 2008 and 2017. And in our campuses, we have sadly seen an increase in suicides. In Kenya, it is estimated that 1 in every 10 people suffer from a common mental disorder. The number increases to 1 in every 4, that is 20 to 25%. People among patients attending routine outpatient services. In a 2017 report titled Depression and Other Common Mental Health Disorders, the WHO ranked Kenya 5th among African countries with the highest number of depression cases. The report went further to show that there exists high levels of depression and suicidal behavior, high levels of mental distress and substance use in Kenya. As student leaders, the news of yet another death of a young person caused by suicide is sad, and it is made worse by the fact that among ourselves we can prevent these deaths. Many comrades suffer from mood disorders, anxiety, trauma-related disorders, and even substance abuse disorders. Many times friends, next-door neighbors are aware of these disorders. They have seen the signs. Today, we are urging all comrades to speak out, to lend a hand to their brothers and sisters keeper. Comrades power!
Power!
Comrades viva!
Viva!
We want to urge all comrades and my fellow Kenyans that mental health is an issue and no one should be affected, no one should be stigmatized. If you have an issue, tunataka tufunguke. It's okay not to be okay.
Comrades, we must not speak in low tones when we notice a brother or sister in distress. We must speak up. Comrades, we must not shame those who seek our help and support. We must embrace them and support them. We must encourage each other to speak up. Comrades, we are suffering and we are all facing harsh economic and uncertain times. But we must resolute, we must be focused, and most of all, we must be there for each other. To our parents, guardians, and the university's administration, kindly support us. We need your help. The silent pandemic of mental health diseases is a heavy burden to bear, and we need your support. To the government, we are calling on a status review of the progress of the Kenya Mental Health policy which covers the period between 2015 and 2030. The policy is a commitment to pursuing policy measures and strategies for achieving optimal health status and capacity of every Kenyan. Further, the government should review the progress of the implementation of the recommendations of the Ministry of Health Mental Health Task Force report of 2020. For instance, the government should consider enhancing the budgetary allocation to the mental health from the current 0.01% of the total health expenditure as reported in the report to a more substantive allocation. This, according to the task force, can be achieved by amending the Mental Health Act to provide for a mental health fund. This endeavor will require a concerted approach to be achieved. And in the spirit of this year's World Mental Health Day campaign slogan, Mental Health Care for All, let's make it a reality. We are calling on like-minded stakeholders to join hands and support us as we seek to tackle this worrying trend among university students. As student leaders, we pledge to be more available to all students who would like to speak up. We also pledge to seek out well-wishers who can fund mental health awareness campaigns among our student populations. In this regard, we are today launching a 60-day online awareness campaign on mental health among comrades in a bid to create a safe environment for comrades to speak and share issues as we seek solutions together using the hashtag Tufunguke Tusaidiane. Thank you very much, and that was our joint statement by the University Students Association.
President Multimedia University and also the sitting president of University President Council. Today, the mental health awareness, as student leaders, we are here to encourage our students, especially comrades across the country. In the recent past few months, we have lost comrades to suicide. We understand there are lots of challenges with this economy, with unemployment, with the stress that comes with the pandemic. We'd like to encourage the comrades to speak up. There is no shame in suffering. We are here for you. Join us in this campaign, 60 days campaign, online, and also partners, including the government. We'd like to encourage you, or rather to demand that you partner with us. In our institutions, there is a counseling office, I know, that is provided in every parastatal or institutions of learning. Please boost these offices by facilitating them and creating awareness of their availability for our students to be able to go to these offices and be able to speak up. For our comrades, we ask you, tafadhali, usijiue, hii maisha ni ngumu, kila mtu anaipitia, and there is no shame in speaking up. So we are looking forward to you partnering with us during this campaign. May the good God bless you.